50 Americans die from prescription drug overdoses every day. It's estimated that more than 6 million people suffer from prescription drug abuse disorders. And now the growing problem is quickly becoming a top public health and public safety concern. In tonight's reality check, News 13's Megan Shearing shows us what one Mountain County is doing to tackle this epidemic.
There's just been an explosion of narcotic abuse across the whole western North Carolina region.
Drug abuse is skyrocketing.
It's out of control, and we see tons of overdoses from narcotics daily.
Statistics show nearly 1,200 people died in North Carolina in 2011 as a result of unintentional poisonings. Most of them from misusing or abusing prescription drugs called opiates, like Oxycodone or Hydrocodone. Dr. Chris Flanders is the medical director of Mission Hospital's emergency department. He says the biggest problem with opiate drug use is that your body begins to tolerate it.
You have to take more and more to get that same effect, to get that high, to get that numbness. And so, unfortunately, that part of your brain that controls breathing, it doesn't get tolerant. And there's a certain cutoff where it stops working and you stop breathing.
And methadone, a drug used to help folks hooked on prescription drugs, it's also causing deaths in our region. From 2001 to 2005, Buncombe County had a total of 43 methadone deaths.
There's about 5,000 deaths annually in the United States from methadone-related overdoses.
This woman, who wants to remain anonymous, worked as a drug counselor at one of Asheville's methadone clinics. She claims drug deals go down in the clinic parking lots.
Folks that are patients of methadone clinics are turning around and selling their methadone on the street, which creates a street drug issue, and I'm really concerned about that.
We watched several people walking in and out of this clinic in a short period of time, but our cameras didn't catch any illegal activity. The sheriff's office says methadone now causes more than twice as many deaths as heroin. Drug agents in Henderson County are seeing problems with the drug too.
The feeling in the interviews that we've done with the people that are addicted to it say there's nothing like it.
But they say prescription pills are taking over their streets.
We're having a lot of overdoses associated with prescription medication, with the methadone, the Percocets. We are having one or two a week, it seems like, unintentional.
The problem, according to authorities, is that it's too easy to get the pills. A recent study shows enough painkillers were prescribed in 2010 to medicate every adult in America continuously for a month. And authorities fear the problem will only get worse if more regulations are not put in place soon. That's where HopeRx hopes to make a difference. It's a coalition of law enforcement, the judicial system, doctors, and educators with the goal of tackling prescription drug abuse in Henderson County head on.
It's really going to be our job as an organization to find out how to address that and really measure how bad that problem is.
Let's work together to address the problem of prescription drugs in our community.
HopeRx is also getting help from parents who've lost a loved one to addiction, like Julie and Don Honeycutt, whose 20-year-old daughter, Anna, died from an overdose in 2010.
This is an epidemic situation, and that no family is immune to this problem, especially in their own homes. If they have a medicine cabinet, they're not immune to a possible prescription drug addiction in one or more of their children.
The couple doesn't want to see anyone else suffer.
Each step that a child takes further and further into drug addiction is a dangerous next step and needs to be turned around as quickly as possible to save a child's life.
With everyone working together, HopeRx believes they can achieve the change necessary to curb the epidemic and save more lives.
Folks that really abuse narcotics don't do it for very long. They either get off or they die.